Good afternoon, Hyson Roland. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I choose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
You can now start your OET roleplay.
Hello, good afternoon. I'm Hyson Roland, one of the registered nurses here. I can see you look quite worried, and that's completely understandable. Please have a seat. To start, could you please tell me in your own words what has been concerning you about your son and what brought you in to see us today?
Good afternoon. Yes, I'm just so worried. For the last day or so, my son Charlie has been needing to go to the toilet constantly, almost every hour, and he's also felt quite warm to the touch, like he has a fever that just won't go away. He's not his usual energetic self at all.
I appreciate you sharing that. It's difficult to see your child unwell. How may I address you?
You can call me Mihiraa.
Mihiraa, to help me get a clearer picture, could you describe his symptoms in a bit more detail for me? For instance, has he mentioned any pain or discomfort when he urinates, or any pain in his tummy or lower back?
Now that you mention it, he did say it stings a little when he does a wee. He's also been holding his lower stomach a few times and saying it aches. The frequent weeing started properly yesterday morning, and the fever came on in the afternoon. It's not very high, but it's persistent.
That's a very important point, and I'm glad you brought it up. Mihiraa, based on everything you've told me, the clinical picture strongly points towards a urinary tract infection. The reason we've come to this conclusion is the specific combination of Charlie's low-grade fever together with his frequent and painful urination. These symptoms are very characteristic of a UTI. I know hearing this can be concerning, but please be assured that we have a clear path forward to help him. Our main recommendations are to encourage him to drink plenty of fluids throughout the day, which helps flush out the bacteria, and to keep a gentle watch on his temperature. The doctor will prescribe a course of antibiotics to target the infection directly, and it will be very important for us to have a follow-up to ensure he is fully recovered. We are here to support you both every step of the way.
All right, but I am so scared. Is it something more serious? Would he be all right soon?
I completely understand your concern, Mihiraa, and it's very natural to worry. I want to reassure you that while urinary tract infections can vary in severity, Charlie's presentation is actually quite manageable. The fact that he does not have a high fever, is not vomiting, and is not extremely lethargic is very positive news. These are the key signs we look for that would suggest a more severe infection or kidney involvement, which we can confidently rule out at this time. While we're discussing what to look for, could you share with me if you have tried any treatments at home already? Perhaps any natural remedies or even over-the-counter medication to help ease his discomfort.
Yes, I gave him a little bit of paracetamol syrup last night when he felt very warm and was restless. It seemed to help his fever come down a little, and he managed to sleep.
That was a sensible thing to do. I can see that Charlie's discomfort is really worrying for you, and managing his pain and fever is a very important part of helping him feel more comfortable while the antibiotics begin their work. Mihiraa, for a child his age, appropriate pain relief would include medications like paracetamol, or alternatively ibuprofen, which can be very effective for reducing fever and easing any general aches he may have. It is crucial, however, that we calculate the correct and safe dosage based specifically on his current weight to ensure both its effectiveness and his safety. I can help you with that calculation right now and provide you with clear written instructions on the dosage and timing, so you can feel confident in administering it at home to keep him as comfortable as possible throughout his recovery. To help us manage his condition, can you tell me a bit about his current fluid intake and his toilet habits? For example, how much is he drinking? And have you noticed any reluctance to go to the toilet because it might be sore?
He's been drinking a bit more water than usual because I thought it might help, but he's still only having small amounts. He's wetting his pants a couple of times, which hasn't happened in years since he was toilet trained, and I think he's sometimes holding it in because he knows it will sting.
I understand that can happen. Mihiraa, once Charlie is feeling better, there are some common strategies we can discuss for managing and preventing future UTIs. These include encouraging him to fully empty his bladder each time he goes, as holding urine in can sometimes be a factor. For little girls and boys, using a proper wiping technique from front to back is crucial to prevent bacteria from spreading. It's also a good idea to avoid things like bubble baths or perfumed soaps in the bathwater, as these can irritate the area, and opting for cotton underwear can help as it is more breathable. Now, the most critical part of his treatment now will be the course of antibiotics the doctor will prescribe. It is absolutely essential that Charlie completes the full course of this medicine. This is crucial because it ensures all the bacteria causing the infection are completely killed, which stops the infection from coming back and also helps prevent antibiotic resistance, where medicines might not work as well in the future.
Okay, I will make sure he finishes every single dose. Thank you for explaining all of that.
You're most welcome, Mihiraa. Now, to make sure we're both on the same page and everything is clear, let me just summarize our conversation. We've discussed that Charlie has symptoms of frequent, painful urination and a low-grade fever, which point towards a urinary tract infection. We've confirmed this is a common and treatable condition with antibiotics. You've already appropriately given him some paracetamol for the fever. Our key recommendations are to encourage plenty of fluids, monitor his temperature, and most importantly, complete the full course of antibiotics we will provide. We also discussed several strategies for preventing future UTIs, like proper wiping and avoiding irritants like bubble baths. Does that all sound correct to you?
Yes, that sums it up perfectly. Thank you so much, Hyson. I feel much more informed and a lot less anxious now.
I'm very glad to hear that. Please don't hesitate to ask if you have any more questions.